Hi, do you or your child have lazy eye? If so, what have you been told by your eye doctor regarding whether it can be treated? There's a lot of misconceptions out there even among eye doctors regarding what's the best thing to do to treat lazy eye. So, my name is Dr. Benny Hsiao. I am a developmental optometrist and am board certified in vision therapy. First of all, let me share with you a little bit about what is lazy eye. The technical definition of lazy eye is technically called amblyopia. That's the medical term, amblyopia. And amblyopia basically just says that one or both of your eyes is unable to see clearly due to either an eye turn or a high uncorrected prescription. This is not just blur. It's more like having a scattered TV signal in your brain. Okay, I'm sure you've had TVs where the channel wasn't properly set up, and the signal looks very, very hazy and scattered. So it's more like that as opposed to just plain blur. So the thing about lazy eye and amblyopia is that there's always a cause, and the cause is, like I said, eye turn or high prescription. If you're unable to see clearly, we have to assume that if there's no eye turn and there's no high prescription, that there must be some type of eye disease causing the blurred vision. There are some common misconceptions about lazy eye. One of the most common being that you cannot treat lazy eye past a certain age. This is simply not true. Another common misconception is that you must treat lazy eye with wearing an eye patch for hours upon hours every single day. Also not quite true. So what do we look at in order to determine whether your lazy eye can be treated? Well, bear in mind earlier I said that lazy eye is not just blur. It is a deficit in how your eyes work. So that means that in addition to being blurry, you also have your eye muscles not being able to move properly. It doesn't track objects as well as it should. It doesn't aim as well as it should. It doesn't focus accurately. The eye muscles don't change focus as well as they should. So we look at all of these types of things in order to determine whether we can treat the lazy eye. And how do we treat it? We treat it with something called vision therapy. Basically, we're prescribing certain types of visual exercises to improve upon the accuracy of how your eye muscles work and how you're able to follow a moving object from one place to another. In addition, regarding patching, what we have found through recent studies is that patching for just 20-30 minutes at a time, combined with vision therapy and those eye exercises, if you do that, actually ends up being just as, if not more effective than patching for hours upon hours every single day without vision therapy. So I just want you to think to yourself, would you rather wear a patch for 20-30 minutes at a time, or would you rather wear a patch for all day? One other thing to bear in mind is that if your lazy eye is due to an eye turn, to a visual misalignment, if that's the case, then patching does not address the visual misalignment whatsoever. Now, the visual misalignment is what caused the lazy eye to begin with. So, if you treat the lazy eye without addressing the visual misalignment, then once you stop patching, then whatever gains you've made through patching is going to come right back because the visual misalignment was never addressed. So do you really want to do all that patching and just to have it get worse again? So I'd like for you to consider to yourself and ask yourself a few questions. Are you happy with the way things are going with your lazy eye treatment at this point, with how your doctor is managing it? And are you getting all the gains that you feel you should be getting? If not, I invite you to give me a call and we could do a consultation and let you know exactly what can be done. Thank you.